Good evening. And on behalf of Vietnam Authority of HIV Control in Vietnam, we would like to express our sincerest thanks to ESTE Vietnam to give us the chance to be here today and give the short presentation about the Methadone program in Vietnam. My presentation includes 4 parts. The first one is about the country background, the second about the HIV and drug use in Vietnam. The third is about the legal document and technical guidelines. And the last one about some points about the achievement, challenge, and direction about the Methadone program in Vietnam. About Vietnam, there are more than 91 million people and only 310,000 kilometers square with 63 provinces, and we have 15 ethnic minorities. And even that the economic in Vietnam is now just in the developing, but the health issues are on the rise as well. These are some facts and figures on HIV/AIDS and drug use in Vietnam. Till the end of 2012, we have 210,000 patients, HIV cases, and estimates around 69,000 on ARV treatment. And according to the Ministry of Security, we estimate that we have 172,000 opioid users in Vietnam, in which we have 50 to 60% ARV patients used to current use drug use. The HIV prevalence in Vietnam among drug use range from 11 to 30%, and this decreased in this recent year from 70.5% in 2010 to 11.6% in 2012. This picture shows that the legal document that's published in Vietnam since 1990 till now, and as you can see that more than 12 of documents that's supported by the government in Vietnam, and the most important that I want to show is a law on HIV/AIDS. That's established on the 2006, and after that we have the decrees 108 to implement the law on HIV/AIDS, and in 2 recent years, in 2012 and 2013, we had the decree 96 of the government on substitution therapy, and after that the Ministry of Health approved the circular 12 about that. About the technical guidelines, the Ministry of Health just has a decision to 5,076 about the treatment guideline of methadone substitution therapy for opiate addiction. And after that, on 2010, we revised the guideline and we established some books about this. About the methadone program in Vietnam, the methadone has used for opiate addiction patients since 1996 in National Institute of Mental Health in Vietnam. But the number of the patients get in this program is too small, only more than 50 patients. But in 2008, the government approved for us to implement the pilot project, which started in 2 big cities with high number of IDUs and HIV/AIDS in Vietnam, is Hải Phòng and Ho Chi Minh City. And since 2009, Hanoi is the 3rd city has been implemented the methadone program in Vietnam. And after the decree no 5,146 date 27 December of 2010 that issues the project of the producing and using methadone in Vietnam for the period from 2010 to 2015. We estimate that we hope that we have at least 30 provinces and cities implementing the program in Vietnam, or at least 80,000 patients in MMT program in 2015. To implement this target, this is a summary of the steps to set up the MMT program in Vietnam. We have 3 main components. The first one is advocacy. We bring to attention the impact for opioid dependent and HIV to the community. 5 key leaders or pioneers to support MMT program in Vietnam, proved by internal evidence or study tour, integrate into legal framework, approve the treatment guideline. And the second point, we implement the pilot project. We develop the integrated model, advocacy neighborhood, set up clinic, training and running, and build in local evidence of the program success. And for the scaling up, we advocate the success or the result from the program. We build in SOP the quality assurance, capacity building programs, and methadone production, dispensing and management, sustainable development focus. And in this, you can see the number of the patients at the first time till now. At the first time, we have only 2 cities, the Hải Phòng and Ho Chi Minh City, with, at the end of the 2008, we have only 645 patients. But in the last of the September 2015, we have 22 provinces implementing this program with 40,000 patients. These are some results from the evaluation of Ministry of Health. About the patient characteristic, 92.8 were male, and the mean age were around 30 years old. And 54.4 had elementary and secondary schooling. 41.7 were unemployment. The mean age of initial injecting drug were 22 years. 59.5% had a history of heroin detoxification in mandatory rehabilitation center. We had 13.7 with the drug overdose and currently risk behavior. We had 30.3 sharing needle and syringe, and 39.3 particular practice unsafe sex. About the health status of the patient in methadone program in Vietnam, we have nearly 50% of them were HIV positive, and nearly the same number with the HCV positive, and 41.8% of the patients are on ARV treatment. Among them, only 25% has CD4 less than 120 cell milli. You can see the number of the TB history of the patient is around 20%, and only more than 10, 11.5% of them have SBV positive. About the methadone dose, this result from the evaluation of the pilot project only. So it means that we do an evaluation on 2 cities, and after 2 years, we have some result from the pilot project. We have methadone dose of the patient in Vietnam has large rank. The lowest methadone dose is only 5 milligrams per day, but the highest dose is 470 milligrams per day. The mean dose after 12 months of treatment were approximately around 100 milligrams per day, and it's nearly the same with the number after 2 years. The methadone dose between group of the patient in a methadone program with ARV and the group of non-ARV is different. After 1 year of treatment, the average dose of the patient with ARV about is higher than the non-ARV and is about the 167 milligram per day, but the average dose of the non-ARV is only 85 milligram. And over more than 5 years, up to now, the methadone program in Vietnam, there is no die due to overdose or drug side effect. About the retention of the patient. The retention of the patient in Vietnam is very good, and the dropout rate is very low. According to report from 11 provinces and cities, with 6,000 patients are continuing treatment participate. The number of patients who stopped treatment was only 520. According to the study, the retention rate after 6 months was 92.5%, and after 2 years were respectively about the 93%. The dropout rate decreased by the time, and this number is much lower than other countries in the world. This some impacts on risk behavior and health. After 2 years, only 16% of the patients continue using heroin. This figure about the illegal rate of patient head inject behavior among the patients still using drug. We have 42% of them still using head inject among the patient. Okay, thank you. This some advantage of methadone program in Vietnam. The legislation system is relatively complete built to deploy the program. The program receives the direct attention of the party, state, and government in the implementation process. At the same time, getting the consensus from the own committee level, civil society, and community. And the program receives guidance, dose, supervision of the technical expert. There is close cooperation between the departments from the center mass of the local deployment during the treatment. Also that we have some challenge for scaling up. The scaling up, but keeping quality is a challenge with us. And program coverage is limited while the need is very large. And the supply methadone for patients is one point that we need to think when we scaling up this program. And now we still lack of the resource, both human resource and financial resource. The treatment experience still limit. It's very difficult to recruit and retain the MMT doctor. In currently, MMT doctors lack clinical experience and to deal with the complicated cases and integration with the other service. And about the acknowledgement, we have the support from the leader of the VAC, the donor, and implementing partner. Thank you for your attention.
Merci beaucoup. On va peut-être prendre une question dans la salle. Est-ce que vous pourriez nous dire très rapidement, can you tell us very quickly who are your main partners, to implement a methadone project around Vietnam?
Yes. The main partner for the methadone program in Vietnam nowadays, we have the support from the BEPFA, the Global Fund, and World Bank. Besides that, we have some support, a new project by Saposung in Ho Chi Minh by Este.